Clinical Issues by Julie Kahn. Use of powered air purifying respirators in the OR. Question: We have a new surgeon with extensive facial hair who could not be fit tested for an N95 respirator. Can he use a powered air purifying respirator in the OR if needed? Answer: The CDC does not recommend the use of powered air purifying respirators, PAPRs, in the presence of a sterile field. However, according to AORN, personnel may use a PAPR in the OR if a facility interdisciplinary team determines that the benefits of using these devices outweigh the potential harms. Use of PAPRs in the presence of a sterile field should be clarified in the facility's respiratory protection policy and procedure. However, until additional research clarifies the effect of PAPRs on sterile field contamination, it is prudent for personnel to limit the use of PAPRs in the presence of sterile fields to situations in which they require respiratory protection that cannot be achieved by a different device, for example, N95 respirator, and not where a PAPR is a matter of convenience, for example, if an annual N95 respirator fit test has expired. The AORN, Guideline for Sterile Technique, states that, quote, an interdisciplinary team that includes an infection preventionist and an occupational health professional should determine whether PAPRs may be used for respiratory protection in the perioperative environment when a sterile field is present, end quote. This recommendation is consistent with similar guidance from the CDC and is based on a theoretical risk of sterile field contamination by unfiltered exhaled air from the user exiting the PAPR. Unfiltered air may increase the levels of OR air contamination, thus potentially increasing the patient's risk for an SSI. It is important to follow the manufacturer's IFU when wearing a PAPR to ensure that the device is working properly and providing the user with the expected level of respiratory protection. In many commercially available models, the belt-mounted blower and tubing are intended to be worn on the outside of a gown to allow for adequate air intake into the blower. If the interdisciplinary team agrees that PAPR use is allowed in the presence of the sterile field, it is important that they create a standardized procedure that protects the sterile field from contamination. This procedure may include a list of the portions of the sterile field that may be covered, type of PAPR device that may be worn, for example, loose fitting, full face piece, hood style. See Figure 1. Location of the instrument tables, and direction of the blower exhaust, if any. It also may be important to specify how the user should wear the PAPR device, the circumstances in which they may be used in procedural settings, and high-risk patient populations, for example, immunocompromised, or procedures, for example, transplantation, total joint arthroplasty, for which the use of the device may be restricted. As a result of the coronavirus disease 2019 pandemic, the use of and literature on PAPR devices have been increasing. In 2020, researchers compared sterile field contamination between two types of PAPRs, a surgical mask, and no mask. The researchers found that both PAPR devices and surgical masks reduced contamination of the instrument table by 100% and 98.48% respectively, when compared with no mask use. There was no statistical difference in the reduction of contamination rates between the PAPR group and the surgical mask group. The researchers concluded that PAPRs and surgical masks reduce contamination transferred from the wearer to the sterile field, but recommend that additional study is needed. It is important to note that this study had several limitations. Most importantly, the study only tested each device on 4 participants for 10 minutes. Additionally, the findings in this study are not generalizable to PAPRs with configurations that differ from those used in the study, including hood-style PAPRs without elastic around the face and PAPRs without filter material located in areas below the chin of the wearer.